This is an instructional video for where to locate and complete a note within the Access program. This is a general overview. You'll find more videos for further in-depth guidance on how to locate and complete the following: infection and incident reports, wound care worksheets, communication notes, medication changes in physician's orders, and how to properly write up your visit narrative. So to find the note in the Access program, you'll go to the Home page, the submenu My Schedule, click on it. It'll bring you to this page here. So for this date, we're using January 18th. There's one note here outstanding. It's the sample patient. For our purposes, we'll be using the sample patient chart. Click on that. I'm going to expand the window. I recommend starting with the previous visit note. This will pull forward roughly 90% of the previous skilled nurse visit information, with the exception of the vital signs, last bowel movement date, pain assessment. It's going to give you a warning sign. Click OK. From there, go to time in and time out. Skilled nurse visits should be a minimum of 20 minutes. The medication administration visit should be a minimum of 15 minutes. And we don't document on travel time or mileage. The physician's date should be added in, the last physician date known. If you don't know, or if the patient doesn't know, I recommend giving the MD office a call. A lot of times our patients don't know the last physician date, and they often miss visits because of that with their doctor, so keep that in mind. Vital signs are pretty straightforward to figure out. Just know that there are some additional measurements here that you can find. So if I click on Expand Pulse, you'll see that there's additional places to add in for pulse, whether you're sitting, standing, or laying down. Expanded on positions of the blood pressure. If for whatever reason you weren't able to locate or collect the vital signs, check this box off here. So if a patient refuses, and then under additional measurements, you'll see fasting blood glucose and other lab values that are pertinent to the patient, or may be pertinent to the patient. So in this case, if the patient's diabetic, we would put in a blood sugar. When you're done with that, you can hit Save and Close. Now under each system, you want to go through each one and document what you assessed on. Please avoid checking off no problems identified unless you're absolutely sure you reviewed each problem area. Prioritize the comments section under each system and make sure you take credit for your assessments. So these are the comment sections here. You can see, if the patient's a smoker, it's good to document that. If they have any cardiovascular history, document whether or not they've had any recent chest pain. If they did have, let's say, some edema, you could expand on that. Also keep in mind that any one of these check boxes that has a colon at the end of it, if you check on it, if you check it off, it will request additional information. So you'll see here, patient responses required. So in order to complete the document, you have to fill these sections out. Otherwise, the program will not allow you to sign and complete the note. Under pain, if you select no, there's only one follow-up question. However, if you select yes to pain, there are several follow-up questions. So you would want to document the specifics of that pain. So let's say lower back pain. Does it interfere with activity? We'll say yes. What is the current pain level? We'll say a 5. What is the best pain or the least pain they've had over the last week? We'll say is none. And then the worst, we'll say it's an 8. Describe the pain. You have several check boxes you can check off. One or all of these, really anything that applies. Are there any nonverbal cues. I'll say NA. And what is the pain relieved by? Well, we'll say rest and medication. Pain management effectiveness. I will say that their current pain medication regimen, let's say they're on Tylenol and PRN, we could say it improves physical function. Are there any aberrant behaviors? If there were, we would select from the drop-down box, are they trying to get extra prescriptions from their doctors, reporting lost prescriptions, overusing their medications, and so on and so forth. I'll say NA here, and then you can add in additional information in the comments section if needed. Under lab work, if there's no lab work, just check off NA. The infection control area here, we want to check off universal precautions. Sharps disposed if there's a diabetic patient. Certainly if there's any infection risk, we want to assess that. At each visit, we're going to be checking off this infectious disease profile, and this is really our COVID-19 screening. So you click on that box, brings you to the COVID-19 screening. You can see here a list of all of the COVID-19 screenings previously done for this sample patient chart. I'm going to start a new one, so I'm just going to click COVID-19 screening. And then here you can see who was screened, the patient, answer the questions, scroll down. You have to check off that the information is correct and that it's yours. You're going to sign it, date it, hit sign screening. You're going to do this for each visit. I'm just waiting for this to load. Alright, we'll exit out of that for now. So once you've done that, you can exit out of that window. Now we're back in the main note. So we're going to go down to homebound status. Each note should reflect the patient's homebound status. So that's reflected down here under homebound narrative. This should automatically get filled out. If you think that this is incorrect, if the patient is listed as not homebound and you believe they should be considered homebound, please reach out to a supervisor. But otherwise, this information is accurate. You can change it. You're not able. I would not change the homebound status without a supervisor's approval. But you can change the information in here to describe why they are homebound or not homebound. Plan of care review. So you review the plan of care with the patient. What is their response? Is there a caregiver involved? Most of the time there's not a caregiver involved. Are there any changes to the plan of care? We'll say no. Discharge planning, we're always supposed to write something here, so I'm going to write that the client is not a candidate for discharge at this time. Under care coordination, we should always write something in the care coordination section. So at least once a week, I would say that we want to write something, whether it's a phone call, text, or email to a supervisor. Also, the doctor, social worker, anyone that's involved in the patient's treatment, any care coordination, any communication with any of them, you put down here. So you may just write something like case conference with something along those lines to show that we are doing our care coordination. Under health management, we would check off medications reconciled. Now, if we had any questions about the medications, you can actually find the medication profile right here by clicking on this box. And here you see the patient's medications. I won't go into this now. I'm going to minimize this window. Home environment altered. Usually there's something in here you can find that's relevant to the patient's current status, maybe poor home environment, unsafe floor coverings, cluttered soil living conditions. Are there barriers to their health status? Are they, financially burdened? Are there multiple comorbidities? So again, just go through each one of these. Anything that has a colon at the end of the sentence or word has drop-down boxes. Be aware of that. Gives you additional information to document on.